Hi everyone, I'm Dr. Sagar Sahu and welcome to Vet Surgery Tips. So today we will be starting a new playlist, or you can say a series on common canine diseases. Okay, so these classes will be different from your normal classroom classes. So we will be not only studying about the disease and the treatment, we also know about what is going on around the world. We will also analyze different research articles published from different countries, and I have analyzed some articles. I have studied them, and I will be giving the best articles which will be useful for you, or you can say you can use for field practice, or also you can use for different research purposes. Okay, there are some limitations also. I have searched from the Google Scholar or normally Google. There are some articles which may not be in Google Scholar. Okay, so if you find those articles, you can also mention in comments, so that all other people can know. Okay, so people can check those comment section, and you can get if any interesting or any useful articles that has been published by students or faculties or any colleagues. Okay, so let us go to our class. The canine pyoderma, this is the first disease which we will be studying. This is a very common disease in field. You will find pyoderma cases very rampantly throughout India, and also basically this disease, the summer is coming now in India, you will find this disease very rampantly. Okay, so you should know, first we will go for dermatology, because you know in summer season you will find dermatological problems. So we are starting from dermatology. We will cover all the common diseases. Okay, so from the first class, that is canine pyoderma. First of all, we will covering different types of pyoderma. The book which I am following for this dermatology section, the book is Small Animal Dermatology by Elsewhere. Okay, Elsewhere publication. If you want that book, you can buy it, or there is some, I think, download link in also in Google. Okay, you can download. This is a very good book. I am following this book. All of the lectures from dermatology will be from this book. Okay, so in that book you will find these pyodermas are separate chapters. You can go to that chapters and you can study in detail, but here we will study in a concise manner. More focus will be on the research articles what is going around the world. Okay, so in this class, or you can say this class covers the different types of pyoderma. Many types. It may be superficial, it may be deep pyoderma. Okay, if based on location, it may be chin pyoderma, skin fold pyoderma. Okay, mucocutaneous pyoderma, interdigital pyoderma. Okay, these are different type of pyoderma. Basically they are pyodermas. Based on location they are named, or you can say based on whether it is in superficial, you will see the lesion is limited to hair follicles and epidermis. Okay, while in deep pyoderma entire skin is affected, also the hair follicles. In superficial pyoderma you will find mostly papules. Okay, papules which may pustulate, but in deep pyoderma entire skin is affected. You will find pustules and furuncles. Okay, basic difference between them, all of them are pyodermas, and basically you can divide more grossly as superficial pyoderma or deep pyoderma. Chin pyoderma can be superficial, can be deep. Okay, but don't know, you may not go deep into the terminologies like interdigital, mucocutaneous, simply pyoderma. Okay, if you are writing in prescription mucocutaneous pyoderma, they may think you are a very big doctor, but thing is just pyoderma. You should know the principles to treat pyoderma. Okay, now the causative organisms. Causative organism, main organism is Staphylococcus pseudointermedius. This is the main causative organism, and this is the most common also. Okay, rest of the organisms are also found. There is an article which we will be going to discuss. Though in those article you will find all these extra. They have been reported from the skin lesion. If you will do the cultures, you may find all these organisms also. You can say these are opportunistic organisms. Main culprit is Staphylococcus pseudointermedius. And remember one thing: this disease is zoonotic. Okay, this disease is zoonotic. It can produce lesions in immunocompromised human patients. Okay, if you are immunocompromised and you have a dog which have a pyoderma, you may get infection, so be careful regarding that. While dealing with this pyoderma patients, if you have to remove some paws or you have to remove some crust, use gloves. Okay, hospital infections are common. Next, you see pyoderma can be a primary disease. Okay, but maximum time it will be a secondary disease. Okay, there will be some diseases which may be underlying cause. Okay, very rarely it is a primary disease. What are the secondary diseases which can be caused? The parasitic, it may be, we will discuss also parasitic disease in separate. It may be demodex, sarcoptes, soroptes. Okay, all those things. It may be a sensitive reaction like atopic dermatitis, flea bite allergy, food allergy. Food allergy is very difficult to diagnose. When nothing works, you can go for food allergy. Endocrinopathy, it may be hypothyroidism or hyperadrenocorticism. It may be if the dog is under immunosuppressive therapy like steroids, you may find the pyoderma. It may be autoimmune disease, it may be traumatic the term which, if you will find pyoderma due to trauma, there is a different term, pyotraumatic dermatitis. It's basically pyoderma. Okay, but in that book you will find a different chapter, pyotraumatic dermatitis. It's a very good book, you can refer. Okay, so let us see some pictures. See here. Okay, these two are superficial pyoderma. You can see these papules. Okay, these are papules. Here, these are papules. Macules, you see, macules, if this is skin, macules are basically very flat structure, you may not feel it. But papules, they are basically slightly elevated structures. Okay, papules. What is pustules? It is same as papule, but it is pause filled. Okay, pustule. So you will find papules in case of superficial pyoderma. You will find pustules in deep pyoderma. But there is not like that. If you are finding papule, this is superficial. If you are finding pustule, then this is deep. It actually involves the thickness of skin. If it's very deep, then it is deep pyoderma. Okay. So here you see these are papules, and this white thing is crossed. Okay, scientific term is collarate. Here you can say colarity, epidermal colarity. This is very characteristics to pyoderma. Okay, these collarates. We will see other pictures also. There you can see very clearly. See here. This is a picture. You can see this colarity, this white crossed like thing. You see this. This is colarity. These are colarity. Okay, these are very close up view pictures. Okay, these are papules, erythematous. They are red in color, red patches. Here, this is a very close view. This is a papule, elevated structure, and here you will find this cross, or you can say colarity, epidermal colarity. This is very characteristics to pyoderma. Okay. Now, another picture. You should see more pictures. Okay, so that you will know. Sometimes it may not be directly the lesion. Maybe some, you see, in short hair coat breeds, it is moth-eaten appearance. Moth-eaten appearance, which is very characteristic to pyoderma. You see this moth-eaten appearance, moth-eaten alopecia. Okay, in this book you will find a very good number of images. Very good number of images. I have collected from that book. This is a very good book. Okay, this is a superficial pyoderma. These are papules. These are papules. Okay, and here you will find these crossed. Around this, you see, you can notice these crossed. Okay, another picture. Okay, you see, this is a healing picture actually. Okay, most typical epidermal colarity in dog with resolving pyoderma, healing pyoderma. You see, this is papule, or you can say skin lesion. Sometimes they are very much circular, and it may confuse with fungal dermatitis, but you have to look for these crossed. Okay, see these cross, they are very much characteristics for pyoderma. Okay, here another picture. This is moth-eaten appearance for short hair coat breeds. You will find this characteristics appearance for pyoderma. You see, this is deep pyoderma. Okay, deep pyoderma. This is a furuncle actually. In this much, it's completely furuncle. Okay, it will be a very big hard structure like an abscess, and here you can say blood tinged pus is coming out. Here you can see, here there is a furuncle. Okay, here. Okay, these are deep pyoderma, entire thickness of skin, and it may go up to the connective tissues. Okay, so this is deep pyoderma. And here another example of interdigital pyoderma. This is between the digits. This is pododermatitis. Okay, in the leg region. Okay, these are digits. Okay, and this is digital pad, and this is the lesion. Okay, so these are deep pyodermas. Entire thickness of skin is affected. This is chin pyoderma. You see, there is only at the chin region. This is the chin. This is the lower jaw actually. Okay, chin region which is affected. This is not chin pyoderma. If it is affecting the mucocutaneous junction, this region only, this is mucocutaneous pyoderma. Okay, only the it is named according to its position. Okay, simply they are pyodermas. Okay, next, see, this is skin fold dermatitis or skin fold pyoderma. Here is a skin fold due to more sweating, or if you are not cleaning your dog properly, you will find this pyoderma. This is erythematous lesion. It will be moist. Okay, so you will find pyoderma. And can you tell any other folds? Vaginal folds. You will find vaginal fold dermatitis. Okay, vaginal folds. And there are some breeds of dog which has very big folds all around the body. There will you find the skin fold dermatitis. Okay, now diagnosis, you see, differential diagnosis basically the finding the underlying cause. Many times it will be due to the parasitic diseases or the hypersensitivity or endocrinopathy, anything. Okay, so that is the differential diagnosis. If you have to find what is the underlying cause. Okay, you can do the cytology. Simply take an impression smear, you will find neutrophils and the cells. Dermatohistopathology, it may take some time. Histopathology usually takes time. From that also you can know the pyoderma status. You can do best is the bacterial culture, which bacteria has been isolated. Okay, this is the diagnostic part. Most of the in field condition you will know from the clinical sign. That is why I showed different photographs and different body parts. Okay, so that you will know it in a better way. But if you are doing good diagnostic, then you are a very good vet. Diagnosis is always important. Now, treatment. You see, treatment, the important thing in pyoderma, in pyoderma treatment, the main thing is the principle. It's not the drug you are choosing. Okay, it is the principle of treatment. If you are following the principle very nicely, you will get very good results. If you are not following the principles, then you may not find a good result. Okay, first important thing is find the underlying cause. Okay, I already told you that pyoderma most of the time is from the secondary causes. Okay, it is a secondary cause. The primary cause may be some parasitic diseases, parasitic dermatitis, hypersensitivity, endocrinopathy, okay, or trauma, anything. First, you have to find the underlying condition. If you treat that in better way, then the pyoderma will automatically resolve. Okay, you can go for systemic antibiotic. You see, it is a multi-drug therapy. It is never a single therapy. It is a multi-drug therapy. Systemic antibiotics. For superficial pyoderma, the principle is you should use antibiotics for 3 to 4 weeks, and if the symptoms resolve, then give the antibiotic 1 week beyond the resolve point. Okay, suppose a treatment superficial pyoderma resolved in 3 weeks. Their symptoms are gone, but you have to give the treatment for additional 1 week to make it 4 weeks, so that the entire infection should be gone. Okay, it is the principles of treatment. It's not the drug which you are choosing. Most of the drugs are effective. Okay, we'll discuss about drugs also. In case of deep pyoderma, the principle is you should minimum treatment period is 6 to 8 weeks, and you have to treat the animal 2 weeks beyond the resolving of the clinical signs. Okay, concurrent bathing, that is basically topical therapy. You have to combine the topical and the systemic. Okay, we will discuss the resistance also. There are some better treatment protocols. We will know that these are basically treatment options. What to choose, you should know. Okay, Non-concurrent bathing every 2 to 7 days depending on degree of pyoderma. Remember to choose those shampoos or creams or gels or foams which contains chlorhexidine or benzyl peroxide. They are very good antiseptics and they act on pyoderma. Okay. Fourth point is, if lesion do not completely resolve, go for culture. Okay, culture and sensitivity, then use another antibiotic. Okay, this is the best thing. Next, these are some antibiotics I have taken from that book. Okay, the first line of drugs you can use cefadroxil, cefodoxime, cefovecin, cephalexin, okay, cephadrine, amoxicillin, clavulanic acid. You can use potentiated sulfonamides. Okay, sulfadimethoxam and ormetoprim, and also you can use trimethoprim sulfadiazine. These are potentiated sulfonamides. The second line of drugs are basically chloramphenicol. Chloramphenicol have very side effects also. So you may use clindamycin and erythromycin. Okay, these are drugs which you can use. Do not go to higher drugs. It may cause resistance. Okay, always start from the basic drugs. Okay, you can start with the amoxicillin sulbactam, or you can say cefodoxime. Okay, then you can see the effect. Then you will change the antibiotics. Next, if you find antibiotic resistance, you have changed some antibiotics, still there is not a good response, change to topical. Okay, go for frequent bathing for antiseptic bathing which contains chlorhexidine or benzyl peroxide. And you can combine two classes of antibiotics. See, there are two types of antibiotics: bactericidal and bacteriostatic. Most of the antibiotics which we commonly use, they are bactericidals like cephalosporins, penicillins, the fluoroquinolones, aminoglycosides. They are bactericidal. So okay, if you are combining, the principle is you have to combine two bactericidal antibiotics to give or to get synergistic effect. You can combine bactericidal with bacteristatic like tetracyclines. Okay, tetracycline sulfonamides, they are bacteriostatic to get additive effect. Do not combine same category bactericidal to bacteriostatic, it will be negative effect. Okay, best is combine two bactericidal antibiotics to get synergistic effect. Okay, and go for cultural sensitivity. Okay, this is for deep pyoderma. Sixth point is for deep pyoderma. The crust which you will find is very thick in case of deep pyoderma. So the crust should be loosened and the exudates should be removed. Okay, the pus or any material which is filled, it should be removed, and give warm water swabs, which is basically the physiotherapy in case of deep pyoderma. It is additional things. So all the points you have to remember, and according to the situation you have to give. You see, the skin diseases, it may not be exactly pyoderma, it may be fungal plus the pyoderma, it may be parasitic plus pyoderma. Okay, so you have to design your drug protocol. Okay, next we'll go some research papers. Okay, what are going on around the world. This is the article named risk factor associated with the antimicrobial resistance of Staphylococcus in Canine pyoderma. This is basically a resistance study, and the risk factors are actually indiscriminate use of antibiotics. Okay, so this was conducted in the Spain in 2011. So they found out, this was conducted in urban dog population. Okay, urban canine population. They found that about 78% lesions or 78% cases, the Staphylococcus pseudointermediates was resistant to one antibiotic. In 32% cases, it was found that they are multi-resistance, and 10.4%, nearly 10%, are methicillin resistance. Okay, you see 100 dogs and 10 dogs are methicillin resistance. This is serious. Okay, this is a resistance study. This is another article. The effectiveness of systemic antimicrobial treatment in canine, superficial and deep pyoderma. It is basically efficacy of different antibiotics to treat the superficial and the deep pyoderma. This was conducted in 2012 in London Royal Veterinary College. So the superficial pyoderma, they found high efficacy to be cefovecin. Cefovecin is given subcutaneously. Okay, cefovecin. And moderate to high efficacy was for the amoxiclav, the amoxicillin clavulanic acid, cefadroxil, trimethoprim sulfamethoxazole, or metoprim sulfadimethoxazine, and the clindamycin. These are basically moderate to high efficacy to treat superficial pyoderma. For deep pyoderma, the high efficacy was amoxiclav, amoxicillin and clavulanic acid. Moderate was pradofoxacin, cefadroxil, and cefovecin. Okay, so this is the study in London. This is another article. Efficacy of anticephalococcal protein P128. P128 is expressed by SSC coli for the treatment of canine pyoderma potential application. This is the Indian article. I am very proud of it. Okay, the Indian article study conducted in 2013 in India. Okay, so they found this protein which has lytic activity on Staphylococcus pseudointermediates. This can be used for MRS, methicillin resistance Staphylococcus. Okay, this is a very good article. Maybe it may be used in future also. This is another article. What has changed in canine pyoderma? Narrative review. This is a very good article. You can download it and you can study it. This is a very good article. It actually tells about studies about principles of treatment. Okay, this was conducted in 2018 in London, Royal Veterinary College. Topical therapy can be effective as the sole antibacterial treatment in superficial pyoderma. Okay, you may not need or you should not go for the systemic antibiotics in case of superficial, especially if it is very localized in nature. Okay, so you can go for the topical therapy as sole antibacterial treatment. Okay, antimicrobial treatment. The systemic therapy, the principle is as little as possible but as much as necessary. As little as possible means you should not use more number of antibiotics. You should not use unnecessary high doses of medicine. If at all necessary, then go for the higher dose. As much as necessary, it means whatever is required. If the treatment is required for 3 to 4 weeks, go for it. Do not stop it in between. Okay, soft therapeutic doses are a risk factor for the antimicrobial resistance. This is a very important point. Fluoroquinolones should only be used after cultural sensitivity. The problem is, if suppose you are using enrofloxacin, if it is found to be resistant towards enrofloxacin, it will be entirely resistant to entire fluoroquinolones. None of the fluoroquinolones will be active, or you can say it will develop the resistance to all fluoroquinolones. That is why fluoroquinolones should not be used, or it should only be used after cultural sensitivity. Okay. And other treatments, newer antibiotics like glycopeptides, linezolid, and the newer antibiotics, aztreonam, vancomycin, the newer antibiotics, they should only be reserved for the human use. It should not be used in the pets, because you see it is a zoonotic disease. If you are using pets, you see it's true fact that we are using indiscriminate antibiotics in animals. Okay, because they can't speak. There are some reports in different colleges that the antibiotics are indiscriminately used. That is why the resistance is high. Okay, so the newer antibiotics, if you are using directly the newer antibiotics on pets and the staphylococcus is resistant, then if it is going to a human patient, then none of the medicine will work. That is why this article suggests the newer antibiotics should remain reserved for the human patients. Okay, next, antimicrobial peptides. This is a newer study. You can study in the article. Okay, antimicrobial peptides, this can be used for the methicillin resistance staphylococcus. Okay, this is a very good article. I like that article. You can study you can find in the internet also. So this is the article. Sodium hypochlorite / salicylic acid. Salicylic acid is basically a carrier. Sodium hypochlorite is the bleach. Acid shampoo for treatment of canine staphylococcal pyoderma. This study is for the superficial pyoderma. The study was conducted in 2019 in USA. Okay, sodium hypochlorite and salicylic acid were used 3 times a week for 4 weeks, and they were evaluated between 2nd and the 4th week. Okay, they see that there is significant improvement if only used under the antibiotics. If you are giving only antibiotics and you are giving antibiotics along with this sodium hypochlorite salicylic acid, you will find a better result. Okay, next, this is an Indian article also. Study on prevalence and resistance patterns of bacterial pathogens isolated from canine pyoderma. Those things which I mentioned in the causative organism are from this article. Okay. So what does this article say? It is conducted in 2019 in India. Maximum susceptibility to it was found that maximum susceptibility was to amoxicillin clavulanic acid followed by cephalexin for the Pyoderma, and they are 100% resistant to oxytetracycline. So do not use oxytetracycline unnecessarily. This is India, so you can apply in India also. Okay, I think this was conducted in Mathura College, Mathura Veterinary College. Next, treating canine pyoderma with topical antibacterial therapy. You see, many of the articles they stress upon the topical antibacterial therapy. Okay, because resistance develops very less. Okay, you should not unnecessarily go for systemic antibiotics. So this was conducted in 2020 in London. So they stressed upon topical antimicrobials, 3 to 4 weeks treatment, and this is solely for superficial pyoderma. Okay, this is not for deep pyoderma. This is the article of rifampicin treatment of canine multi-drug resistant methicillin resistant staphylococcal pyoderma, retrospective study of 51 cases. Okay, they used rifampicin. Okay, I did not mention about rifampicin. This may be used in resistance methicillin resistant staphylococcus. So you should not go for directly to rifampicin. If you are not finding any antibiotic working, then you may go for the rifampicin. So dose should be less than 6 mg per kg per day. Okay, it should be used along with topical antimicrobials. It has some promising results. Okay, next article. This is a very good article also. Fluorescent light energy in management of multi-drug resistance canine pyoderma, a prospective exploratory study. This study was conducted in 2022, previous year, in Italy. Okay, in Italy. So they used the fluorescent light energy, the CFL ball also. And they used a FLE ball along with systemic antibiotic. Okay, they did not use any topical. So the FLE ball was basically for the topical treatment. So they used twice a week till total resolve. So the average time taken to totally resolve the case was 3 weeks. This is very good because the antibiotic will be given for 3 weeks, lesser the period, less use of antibiotics, and total resolve of the condition. Okay, so this can be used. Okay, so this is the last article. In vitro antimicrobial activity of piper beetle leaf, in Hindi pan leaf. Okay, and some topical agents against methicillin resistant and methicillin susceptible staphylococcus strains from canine pyoderma. This study was conducted in Thailand. Actually, they found some results. You see, I am not much favor of personal in herbal treatment, but they are doing very good thing. Maybe in near future we will switch to herbal. Okay, because in the scenario you see how much resistance the staphylococcus is developing. You may go to the old age. It's all right. Okay, so this was a research article from Thailand. So this is all about the research articles. If you find any other research articles, okay, if your college is doing some research articles, you can post in comment down below so that all other can watch those comments, or you can download those links, download those PDFs also. Okay, so this is all about canine pyoderma. Okay, I hope this was very helpful and you saw some new type of classroom study. Okay, I thought that maybe if I'll give some research ideas. Okay, if you are doing research on your college, or if you are PG student, you can do some more further studies. It will be helpful to you. It's my view. I don't know how much it was helpful. You can comment down below if this was very much helpful to you. Okay, so next class we may go for the parasitic dermatitis. Okay, we'll see that dermatology next class. Till then, tata, bye bye, take care.